Hi, I'm A. Charlene Leach. I'm the Executive Director of PFund Foundation. As the Upper Midwest LGBTQ Grassroots Community Foundation, PFund Foundation is deeply rooted in the history of the HIV/AIDS crisis. We were founded in 1987 to be a vital resource and catalyst for the LGBTQ community. Our work has always been centered in uplifting the most marginalized of our society and supporting leadership for our movement to be bold and to thrive in prosperous and challenging times. This World AIDS Day, we mark the absence of those we have lost while working toward the full inclusion of those living with HIV/AIDS. The HIV/AIDS epidemic has been one of the deadliest in human history, claiming the lives of 35 million people over the course of several decades. Over 36 million people worldwide live with the disease, but medical science has now advanced to the point that the condition can be effectively managed. Modern medicine can reduce an HIV patient's viral load to the point where they are effectively incapable of transmitting the virus. And yet, with all the medical and scientific advances over the last decade, we still wrestle with stigma and judgment of people living with HIV/AIDS. We still conceptualize this disease as the consequence of bad choices and bad people, rather than what it is, a disease that requires dedicated research, funding, and fierce advocacy at every level of government, whether county, state, or federal, and a strong commitment to eradication. Earlier this year, the Trump administration reallocated $186 million of Health and Human Service funding that impacted Ryan White HIV/AIDS ADAP program, CDC's HIV prevention, STD prevention, viral hepatitis, and the Minority AIDS Initiative. It is unknown if this federal funding will ever be recovered, but its impact is being felt at every level, especially by those living with HIV and AIDS. The faces of those impacted by HIV and AIDS is often overlooked in our discourse. Women accounted for 19% of new HIV diagnoses in 2016. Black and African American women are disproportionately affected by HIV compared to women of other races and ethnicities. Of the total number of women living with HIV at the end of 2015, 59% were African American, 19% were Hispanic or Latinx, and 17% were white. According to current CDC estimates, around 1/4 of transgender women are living with HIV. More than half, an estimated 56% of Black and African American transgender women are living with HIV. Among the 3 million HIV testing events reported to CDC in 2015, the percentage of transgender people who received a new HIV diagnosis was more than 3 times the national average. At PFund Foundation, we know these statistics can seem daunting. Fortunately, with the generosity of community members and allies, our annual grant-making cycle goes to support LGBTQ and allied leaders who work at the intersections of identity and community impacted by disparities. Our elevated priorities for funding LGBTQ people of color, transgender and gender nonconforming communities, LGBTQ North and South Dakotans, guide us in combating the social and institutional stigma, bias, and discrimination that are at the very heart of injustice. On this World AIDS Day, we honor our roots while continuing the work of dismantling the systems of oppression so that we may all live free from discrimination, violence, invisibility, and isolation. So today, on World AIDS Day, get tested, know your status, and join the fight to eradicate HIV.